We're joined now by Dr. Henryk Barthel. Now you're delivering the neurology highlights for this conference. Can you tell us a little bit about what is new and different from last year?
Yes, for the brain imaging part at this meeting there is a lot of new exciting developments. My personal favorites relate to new PET tracers which allow us now to image so-called tau pathologies like in Alzheimer's disease, but other new tracers for imaging of neuroinflammation.
And what do you think are the most exciting developments and areas of research in neurology?
Yeah, there's this interesting shift of thinking with regard to diagnostic categories like in Alzheimer's disease, where we now think that it is really important to implement biomarkers into the diagnostic setup. One example in this regard relates to amyloid imaging, but also these new emerging tau PET tracers.
What do you think are the most significant advancements?
Yeah, specifically for the new emerging tau PET tracers, there was this limitation of the first generation tracers, that they were limited in their diagnostic range and that they also had significant off-target or unspecific binding. And we now at this conference see new emerging second generation tau PET tracers which seem to be much better in this regard and allow us to get an accurate tau pathology diagnosis quite clearly now.
Wonderful. And where do you think things are going? What do you think is the future in the next 20 years or so in neurology?
I'm convinced that PET and SPECT imaging will gain broader clinical significance in the next years to come. This refers, for instance, to amyloid imaging, where we in the next years expect to see evidence that there is a clinical utility and also a positive outcome effect of, for instance, amyloid imaging, which will then allow us to offer this new tool to a broader range of patients in our daily clinical work.
Well, Dr. Barthel, we really appreciate you joining us. Thank you.
Thank you.